So now let's go over the ToRCHeS infections. These are very high yield infections, and we're going to be discussing them in great detail. The ToRCHeS is a mnemonic to describe the collection of pathogens that can cause congenital defects in a baby when his or her pregnant mother is infected. The pathogen is acquired during or even before pregnancy and can cause serious disease in the neonate. On your OB/GYN rotation, you'll be spending a lot of your time reviewing charts to find any history of these infections. For your Step 1 exam, you need to know 4 things about these infections. Most importantly, you need to know the names of the infectious agent. You need to know the modes of transmission. You'll need to know the maternal manifestations. And you'll need to know the neonatal manifestations. So now, can you tell me what the ToRCHeS mnemonic stands for? Let's fill it out together. It stands for Toxoplasma gondii, rubella, the rubella virus. It stands for cytomegalovirus, as well as herpes simplex virus. And there's actually one more H, HIV. And then there is the syphilis infection, which rounds out the mnemonic ToRCHeS. So now, as a clinician, when would you begin to suspect a ToRCHeS infection in a pregnant mother? The signs of infection are rather nonspecific, but common signs include hepatosplenomegaly, jaundice, thrombocytopenia, and growth retardation during the growth period of the baby. Before we discuss the ToRCHeS infections, there are 5 other important infections that can cause disease in the neonatal period that are not considered a ToRCHeS infection. These include Group B strep, E. coli, listeria, parvovirus, and chlamydia. The first 3 organisms here can cause meningitis. Do you remember how we would treat a listeria infection in a baby? We treat with ampicillin. Very good. If a mother is infected with parvovirus B19, it can pass through the placenta and cause a congenital defect in the fetus. Specifically, it would cause hydrops fetalis. Now, how would a parvovirus B19 infection present in a pregnant mother? A mother with parvovirus infection would present with fever, malaise, and some joint pain. Very good. Chlamydia species can cause pneumonia and conjunctivitis that is seen in the 2nd week of life. So can you remember how we would treat chlamydia? We would treat chlamydia with a macrolide, specifically erythromycin or azithromycin, or we could even use doxycycline. Now wait a minute, why wouldn't you want to use doxycycline in neonates? Because remember, it is a tetracycline which can cause inhibition of growth and teeth discoloration. So just to review, E. coli, Group B strep, listeria, and chlamydia are passed to the neonate during birth when the baby comes in contact with the mother's vaginal canal. On the other hand, parvovirus B19 is passed transplacentally. So now let's go through the ToRCHeS infections one by one. Toxoplasma gondii is most commonly acquired from cat feces. It is also acquired through undercooked meat. In the mom, toxoplasma doesn't cause a noticeable infection. In fact, it is typically asymptomatic. However, if the mom is infected during pregnancy, the protozoa can pass to the neonate and cause a very serious disease. Toxoplasma causes a classic triad of symptoms, including number 1, a chorioretinitis, which is an infection of the choroid and retinal layer of the eye. This can lead to blindness in the baby if untreated. The second complication is hydrocephalus, which is the dilation and expansion of the cerebral ventricles. Here is an image of hydrocephalus in an adult. We can see the ventricles are grossly enlarged and significantly dilated here. In the neonate, we have to remember that the cranial sutures aren't 100% fused, so the skull would actually look enlarged because of the increased ventricular size. If we remember back to neurology, do you remember the two types of hydrocephalus? Remember, there is communicating and non-communicating hydrocephalus, where non-communicating hydrocephalus is caused by structural blockage of CSF circulation within the ventricular system, and communicating hydrocephalus is when there is a reduced CSF absorption by the arachnoid granulations. The final feature of toxoplasma infection in the neonate is intracranial calcifications. These are seen and picked up on MRI and is a characteristic lesion of any patient infected with toxoplasma, neonate and adult. Rubella is the next ToRCHeS infection. Do you remember what kind of virus the rubella virus is? Remember, it is a positive stranded RNA toga virus. Very good. It is often acquired through respiratory droplets and can cause a rash, post-auricular lymphadenopathy, and arthritis in the infected mother. I cannot overemphasize how important post-auricular lymphadenopathy is in rubella infection. When rubella is passed from the mother to the fetus, it can cause patent ductus arteriosus, or PDA. What kind of murmur would you hear in a baby with a PDA? You would see a continuous or hear a continuous machine-like murmur. Here's an image illustrating the blood flow in a patient with a PDA. It is a common left to right shunt seen in babies. Congenital rubella can also cause cataracts, as we see in this image. Notice the cloudy lenses when you look in the patient's pupils. It can also cause deafness, as well as its main buzzword, a blueberry muffin rash. Bear in mind that congenital rubella is rarely seen in the United States today because of the extensive use of the MMR vaccine. This vaccinates against rubella in the mother. Cytomegalovirus is the next ToRCHeS infection. CMV overall is a very common pathogen and many people in the general population are infected by it. Do you remember what kind of virus CMV is? It is a DNA herpes virus. Very good. CMV is typically acquired through sexual contact, organ transplant, or other forms of close contact. It typically causes an asymptomatic disease and usually can only cause disease in immunocompromised patients such as those with HIV. In these patients, it typically can cause a mononucleosis-like illness. Thinking back to virology, do you remember, does this cause a heterophile positive or a heterophile negative mononucleosis? It causes a heterophile negative mononucleosis. And do you remember which virus causes the heterophile positive mono? That would be the Epstein-Barr virus, another herpes virus. When CMV is passed to the fetus, it can cause hearing loss, seizures, and a petechial rash, or even a blueberry muffin rash, as we saw with rubella. Remember, CMV is the most common cause of congenital defects in the U.S. today. The next two ToRCHeS infections start with the letter H, HIV and herpes simplex virus 2. HIV is a dangerous infection for the developing fetus that can lead to recurrent infections in the baby, chronic diarrhea, and a failure to thrive. Do you remember what kind of virus HIV is? It is an RNA retrovirus. Herpes simplex 2 is the most common cause of genital herpes, while HSV1 is the most common cause of oral herpes. The herpes simplex virus can be acquired through skin or mucous membrane contact during childbirth and can result in serious disease for the neonates, including herpetic lesions and encephalitis. It is so severe, in fact, that it is an indication for a cesarean section. We can see that this infant has a vesicular outbreak on his feet that is significant of congenitally acquired HSV. In terms of the encephalitis, Do you remember which lobe of the brain is typically affected by herpes simplex virus? Typically causes it in the temporal lobe. Lastly, the S in ToRCHeS stands for syphilis. Do you remember what organism causes syphilis? That would be Treponema pallidum, a spirochete. Very good. When passed to the fetus, syphilis is often deadly and results in stillbirth and hydrops fetalis. Hydrops fetalis is a very serious condition in the fetus characterized by an accumulation of fluid causing edema in multiple compartments in the baby. This is also seen in erythroblastus fetalis and in parvovirus B19 infection. If the child survives, he or she can present with many facial abnormalities that will manifest later in life. Shown here is notched teeth known as Hutchinson teeth. This is characterized by triangular-shaped incisors, which we can see here in this image. Also seen is a saddle nose, short maxilla, saber shins, and even cranial nerve 8 deafness. Saber shins are also known as osteoperiostitis of the tibia. It appears as this sharp anterior bowing of the tibia, which you can see here in this image. Now time for a flash quiz. What are the 4 classic findings seen in a neonate born with congenital CMV infection? The neonate can be born with hearing loss, seizures, diffuse petechiae, and a blueberry muffin rash.